Hello, my name is Inês Nunes da Cunha and I am the FIP Practice Development and Transformation Manager. Welcome to this CPD Bites about the chronic kidney disease pharmacy toolkit. Before we dive into the main content, let's take a moment to go through the learning objectives of this video. By the end of the session, you should be able to describe the global burden of chronic kidney disease and its risk factors, recognize the critical role that pharmacists can play in early interventions of chronic kidney disease, identify opportunities to raise awareness and screening of chronic kidney disease, particularly among at-risk groups, and understand how to integrate the chronic kidney disease pharmacy toolkit into practice. This video provides a brief overview of chronic kidney disease, or CKD, its burden, risk factors, and links to other chronic disease. Then, we will highlight the important role pharmacists can play in supporting people at risk or living with CKD. Finally, I will introduce the CKD Pharmacy Toolkit, a practical resource developed to support pharmacists in this area. Chronic kidney disease refers to abnormalities in kidney structure or function that lasts for at least 3 months and have implications for a person's health. This includes markers of kidney damage and a reduced glomerular filtration rate. CKD is a growing global health concern. In 2021, more than 850 million people were estimated to be living with some form of kidney disease. It is now the third fastest growing cause of death and is expected to become the fifth leading cause of mortality worldwide by 2040. People with CKD are also 5 to 10 times more likely to die prematurely from cardiovascular disease or a major cardiovascular event. Although there is no cure, early detection and treatment can help further kidney damage and slow disease progression. There are several risk factors and common comorbidities that increase the likelihood of developing chronic kidney disease. These include conditions like diabetes, hypertension, cardiovascular disease, and a family history of kidney problems, all of which significantly increase the risk of developing CKD. CKD is often a silent condition that can be life-threatening if left undetected. A striking fact is that 9 of 10 people with CKD don't know they have it, and this is true in both developed and developing countries. A person may lose up to 90% of their kidney function before any symptoms appear. That's why early identification is crucial. It allows for timely treatment to slow disease progression and prevent complications. Some patients living with CKD or at risk of developing it may not yet fully understand the seriousness of the condition. Pharmacists can play a vital role in raising awareness, improving patients' understanding of CKD, and helping them recognize the consequence of not taking any action. By understanding risk factors and early symptoms, patients are better equipped to take proactive steps to protect their kidney health and to reduce the risk of disease progression. And pharmacists can support patients by, for example, providing easy-to-read, accurate, and up-to-date CKD educational materials, explain key terms and tests that the patient may need using patient-friendly and accessible language, educate on the impact CKD can have on daily activities and quality of life, and also guide patients to primary care services for screening, diagnosis, or intervention. To support pharmacists in managing chronic kidney disease, the CKD Pharmacy Toolkit was developed for community pharmacy teams. It's designed to aid in the early identification of at-risk individuals and to provide motivational counseling that empowers patients to take action. The toolkit helps pharmacists initiate meaningful conversations and ensure that every interaction with patients at risk of CKD has real impacts. It integrates smoothly into existing pharmacy operations, aiming to minimize the burden on workload and workflow. You can access to the CKD Pharmacy Toolkit via the FIP NCD's microsite. Simply go to the main NCD's areas, select Chronic Kidney Disease, and then click on Toolkits. This toolkit is composed of 5 key elements, which are organized into 3 practical steps to guide pharmacist intervention in community pharmacy settings. The first step is recognize and identify. In this step, the focus is on raising awareness and spotting potential risks. And the toolkit includes e-learning modules, which provide essential knowledge about CKD and its risk factors, and disease awareness posters designed to engage and inform patients visiting the pharmacy. Step 2 is start a conversation and take action. Once a patient is identified as being at risk, the next step is to engage them in a meaningful conversation. This involves using the CKD risk assessment tool to help evaluate the individual's risk level and sharing the patient information leaflet, which offers clear and accessible information to support patient understanding and encourage self-care. Finally, when appropriate, pharmacists can support referral and ongoing management by collaborating with primary care. The primary care referral letter is a structured communication tool that helps facilitate this collaboration, ensuring patients receive the follow-up and support they need. I will now walk you through each element of the CKD Pharmacy Toolkit in more detail so you can see how they work in practice and how they can be applied in your pharmacy setting. The first step is for pharmacists to complete the CKD Pharmacy e-learning module. This provides essential knowledge to support the identification of at-risk patients and the delivery of effective counseling. The module is designed for both pharmacists and pharmacy team members and is divided into 2 short parts. Completing both modules is recommended before implementing the toolkit in practice. Module 1, Understanding Chronic Kidney Disease, covers key topics such as what CKD is, its link to cardiovascular risk, common screening tests, complications, and also provides a framework for early screening and treatment goals. The second module, Identifying Patients at Risk of CKD, focuses on the pharmacist's role in detection and patient engagement. It includes a case study and guides users through the use of the risk assessment tool, starting mindful conversations, offering holistic advice, and collaborating with primary care. If you already have a solid understanding of CKD, Module 2 can be prioritized as it offers more practical guidance for implementation. Each module concludes with key takeaways and a short quiz to reinforce learning. Aiming to raise awareness, 4 posters about CKD were developed to engage anyone visiting the pharmacy and encourage them to speak with a pharmacist or team member about the risk of CKD. They provide key messages including that CKD can have no symptoms and that simple tests exist to screen for it. These posters serves as a call to action to speak to a pharmacist without delay. There are 4 versions, 1 general and 3 focus on major risk factors: diabetes, hypertension, and cardiovascular disease. To maximize their impact, place the posters at eye level where they are clearly visible to patients. Ideal near areas where they are already engaging with staff, like above the dispensing counter, in waiting areas or consultation rooms. The CKD risk assessment tool is designed to guide pharmacists through the standardized conversation with patients. It helps identify those at risk of developing chronic kidney disease by focusing on key risk factors, symptom awareness, and the importance of early screening. The tool includes question prompts, educational reminders, and a concise list of risk factors to support patient counseling and decision-making. It applies the principles covered in the second e-learning module. The patient information leaflet summarizes the key points from the pharmacist-patient conversation. It explains that the patient has been identified as at risk of CKD and would benefit from screening. The leaflet includes space to note the patient's individual risk factors with checkbox for applicable risk and an area for additional notes such as blood pressure readings. It also provides clear information about what CKD is and what to expect from screening through primary care. And finally, the leaflet acts as a reminder and encouragement for patients to take action and get screened. The primary care referral letter provides a summary for the primary care physician of why the patient has been identified as at risk of CKD and why they may benefit from kidney function testing for early detection. The letter is a customizable PDF that can be personalized with the patient's risk factors and medication summary. It also outlines the pharmacist's role in supporting the patient and helps coordinate care for early detection. An infographic was also developed. This is a one-page digital visual aid to complement the CKD Pharmacy Toolkit and provides a quick reference guide on where, when, and why to use the toolkit in pharmacy practice. The infographic includes quick links to key practical resources, making it easy for pharmacists to access and apply the tools introduced in the previous steps. In conclusion, chronic kidney disease is often underdiagnosed, which can affect patient health. Pharmacists, being highly accessible healthcare providers, have a vital role in identifying patients who may benefit from further education and screening for CKD. The CKD Pharmacy Toolkit was created to help pharmacists identify those at risk and provide motivational counseling to encourage early screening. The toolkit can be integrated into existing pharmacy services to support better health outcomes for patients. Since CKD shares risk factors with other NCDs like diabetes, hypertension, and cardiovascular disease, I encourage you to explore the FIP NCDs microsite for useful publications on the pharmacist's role in these areas. I hope this video has helped you better understand the chronic kidney disease pharmacy toolkit and how it can support your practice. Thank you for watching.